Mr. Albert, the last time you were here, we did an ECG because you felt like your heart was pounding and you also felt weak and dizzy. We discovered that you were in atrial fibrillation. How have you been feeling since then?
I've been feeling mostly okay. Every couple of days I still get these episodes where I feel like my heart is beating really fast and skipping beats, but I'm not out of breath when I go on walks and also during my normal, just routine activities, I'm fine.
Good, I'm glad to hear that. Now, you still may be in atrial fibrillation. This condition can present different symptoms from one person to the next. Some people don't notice anything, like yourself, but others experience shortness of breath or they might feel lightheaded. Well, it's good that you're not noticing these symptoms now. You should definitely let me know if that changes, okay?
Sure, no, I can do that.
I wanted to meet with you today so we could talk a little bit more about what atrial fibrillation is and explain some of the treatment options available to you.
Okay.
All right, let's start with what atrial fibrillation is. A normal heart has a strong, steady beat. In atrial fibrillation, the two upper chambers of your heart, the atria, are quivering or fibrillating instead of beating the way they should. This is caused by a problem with the electrical impulses that the heart chambers receive, and it can make your heart beat quickly and irregularly. There are three types of atrial fibrillation: paroxysmal, persistent, and permanent. In the paroxysmal type, episodes come and go and they stop on their own. In the persistent type, episodes last for more than a week and they don't stop on their own. And in the permanent type, patients stay in atrial fibrillation and the heart can't be brought back to a normal rhythm. Over time, persistent atrial fibrillation can become permanent. Now, based on the ECG results from your last visit and the fact that you're still in atrial fibrillation today, it looks like you're experiencing persistent atrial fibrillation.
So what are my options?
Well, we have two options that can help your heart beat the way it's supposed to. First option is rate control, the other is rhythm control. Rate control focuses on making sure that the heart is not beating too quickly during an episode of atrial fibrillation. The types of medications that we use to keep the heart rate controlled, that's between 60 and 100 beats per minute, are called beta blockers and calcium blockers. And we also sometimes use a drug called digoxin.
Are there any downsides to these medications?
Yeah, fatigue is the most common side effect, but that's often temporary. Rate control medications can also sometimes cause the blood pressure to drop too low. Adjusting the dosage usually takes care of that.
And what is my other option?
The other option is rhythm control. Now with this option, we try to restore your heart's rhythm to a normal state and keep it there. We can do this either by sending you for a procedure or trying a rhythm control medication. Cardioversion is a common rhythm control procedure that involves delivering an electric shock to your heart, which is intended to restore your heart's normal rhythm. I know that sounds scary, but it's actually a very safe procedure with a high rate of success. If atrial fibrillation comes back after cardioversion, or if we think there's a strong chance that it will, then we typically prescribe special rhythm control medications to reduce that risk.
Any downsides to these medications?
Patients taking rhythm control agents or antiarrhythmics might notice fatigue or an upset stomach, but the most important side effect we look for with these medications is the development of other unwanted rhythm disturbances. These can be serious, and that's why we often choose to start patients on these medications in the hospital, where we can monitor closely how they're working.
And what happens if these medications don't work, or I just don't like the side effects?
Patients who keep having episodes of atrial fibrillation but who don't respond to medication or to cardioversion, we can consider a procedure called ablation. This involves applying radiofrequency energy to the upper chamber of the heart to get rid of the atrial fibrillation altogether. And it's done by a specialist in a hospital laboratory.
Wow. That sounds pretty involved. Doctor, the thing is, I feel fine, and I'm not having any problems at all with my normal activities. So, do I really need to treat this condition at all?
That's a very good question. The simple answer is yes, but let me explain why. I mentioned a little while ago that the chambers of your heart are not beating normally, whether you feel it or not. And because the upper chambers of your heart are beating so quickly and irregularly, they may not allow blood to flow efficiently, and that can cause blood clots to form. Blood clots that form in your heart can leave the heart and sometimes cause a stroke. So we really do need to treat your atrial fibrillation to make sure we minimize your risk of stroke. Right now, though, your symptoms are the most important thing for us to consider when we decide between a rate control and a rhythm control option. And our main goals will be to reduce your symptoms and therefore improve your quality of life.
Okay, I understand this is serious, and I also understand my options. So let me think about it, and I'll let you know if I have any questions.
That's fine. I know I give you a lot to take in. Go home, think about it, but we do need to get started on your treatment. The sooner we select a course of action, the better.
Okay, thanks, Doc.